Johnny Fever. I'm here to talk to you about Trumpcare. He's obviously upset about Obamacare. He says it's imploding. I kind of understand why he says it's imploding. One of the reasons why is because some of the Republican governors have decided not to enforce any of Obamacare. And what has happened is the people that would have been covered on Medicaid, because Obamacare gives 90% of Medicaid to the state, and the state is required to pick up another 10%, but they chose not to do that. That those people that would have been covered still go to the emergency care hospital and rack up bills that would have been covered under Medicaid but are not covered, so that the hospital changes their fees to everybody that really actually is covered, because they have an average of what they want to make, which I completely understand. If sometimes you don't get paid, you charge the people that do pay you a little more. That's what happens. And then one of the other reasons is kind of like auto insurance. I was 16 years old and I was forced to buy auto insurance because my parents had a lot of money. And I was looking forward to the time where I turned 18 years old. I didn't have any money. I wasn't going to buy auto insurance because, fuck it, they can't sue me for anything. I don't have anything. So I wasn't going to buy auto insurance. Then it turns out it was mandatory insurance. And under my parents' insurance policy, I saved like $30 a month. Then if I were to go outside and have my own insurance policy, it would be another $30. So I decided to break down and buy insurance under my parents' policy, even though what I really wanted to do was not have insurance in any way, because the insurance exploded when I didn't have to pay for it until it was mandatory where I had to pay for it. And even though it didn't explode like that for my parents hardly saw a difference in their policy. They were 40-some years old and never had an accident, never had a ticket. Their insurance premium went up $4 or $5, $10, whatever. I don't even know if they went up. I don't even know if it did go up. My insurance went up because I was a youthful driver. So my insurance premium doubled easily because it was mandatory insurance. So, of course, under Obamacare, insurance premiums go up because it's mandatory insurance. I was a big voter for Obama when he said health care for all. I just didn't know that he meant a health care bill for all. And now it appears that they want about 30% of your income to go to your health insurance. And I'm not really sure that's fair. I'm not really sure that we should have mandatory health insurance. I think health insurance is good for everybody. Other countries, Germany, they work 30 hours a week. They have health care for everybody. And they're not working 40 hours a week like we are. Um, that would be something I'd be looking. Maybe if we worked less, we'd be healthier. I don't know. But I definitely know what's currently going on. Some people say that companies are cutting back on people's hours because they don't want to supply health care. More what I see is even though those companies have to provide health care, the employees are opting out. They don't take advantage of the health care because it's still too much. And obviously that's somehow wrong. If someone's going to offer you some sort of benefit and you're not willing to pony up the difference, then somehow something's wrong there. And I don't know if it's Obamacare or what, but something's missing. I'm confident that the Republicans are saying Obamacare is gonna blow up, and when they say that, what I'm sure is not gonna happen is that the hospital down the street isn't gonna close its doors and shut down altogether. That somehow, if I was sick, I could go to that hospital and they would sort of have to treat me. So I really don't believe that the insurance companies aren't going to accept some sort of payment if I'm sick. I just don't believe that. I can't possibly believe that insurance companies have decided that instead of insuring you, we're just gonna pay the difference of what the hospitals charge the people that we can insure, because that's what will happen. Anybody who is really insured is gonna have to pay more.